Gotcha. Thank you. All right, so where do we go from here? First, I want to note that we've actually made amazing progress with a lot of work around integration of midwives into the system. I am really thankful to Senator Dodd, who both in 2020 and 2023 put forth midwifery bills. The first one was nurse midwifery. The second had a combo of different licensed midwife and nurse midwifery components. Really laid the groundwork for kicking off the 2020 decade with some good integration of midwifery. Also, we see that HCI and DHCS and ACOG and others are really working with us to find solutions to the maternity access crisis and outcomes crisis. So you all can take a look at these bills here, but after 2020, after nurse midwives gained independent practice, Midwifery Access California was created. That's the website where you signed up for this webinar. SB 65, the Momnibus by Skinner, created the Midwifery Workforce Training Act. The Budget Act also combined the Midwifery Workforce Training Act in 2022 with Song-Brown, which is the major funding for training programs that do primary care. SB 1375 allowed nurse midwives to perform aspiration abortion independently. After that, AB 1918 created the Repro Health Service Corps, which has directly funded abortion training by nurse midwives. SB 345 and AB 571 last year included midwives in the provider protections for abortion care. So we're really kind of on a roll here, and hopefully there will be more of this to fix this broken system that we have. Just a couple days ago, Assemblyperson Bonta released AB 855, which is a bill about birth center sustainability and the ability of birth centers to be licensed in California and to break down those barriers that are preventing licensed midwives and nurse midwives from licensing their birth centers. So that's super exciting. So what do you do as a person who might be looking to improve the maternity care system, and midwives are a part of that? There's some really important guideposts you need to know about. The International Confederation of Midwives is the global authority on midwifery. I'm going to go through a little bit more of that on the next slide, but there's also the National Association of Certified Professional Midwives, the American College of Nurse Midwives, Birthplace Lab, where there are some of the folks who did that midwifery integration study have a plethora of research and information and tools about midwifery and integration. Midwifery Access California, of course. The two associations on this call, CALM and CNMA, and the Nurse Midwives Foundation. So these are some basic go-to sources that you should keep in your back pocket. After this webinar, you will be receiving a toolkit of information, which will have QR codes and web addresses for these places, so you make sure you get to the right spot. So as I said, the International Confederation of Midwives is the global authority on midwifery, and what you can find there is this really great tool called their position statement on legislation to regulate midwifery practice. And a few things that stand out to me in orange here for what should be the foundation of California's next steps are: one, providing the mechanism for a regulatory body that is governed by midwives with the aim of protecting the public. Through legislation and policy, adopting definition and scope of practice that's congruent with the International Confederation of Midwives definition and appropriate to the country. Enable midwives to practice autonomously, because of course that's what brings midwives to places where they are needed most, instead of being, chained to health systems or hospitals or physicians. And set the standards of midwifery education based on global standards as well. They also have a regulation toolkit that reviews what not to do and what to do in terms of the regulatory environment. And I've given a couple examples there. And they have a regulation checklist where in the toolkit you're going to receive, you're going to see this page filled out in terms of how California matches up to ICM standards for regulation. For freestanding birth centers, there are standards by the AABC. You can go there and get their position statements and the Commission for the Accreditation of Birth Centers. And finally, professional position statements are available at the National Association of Certified Professional Midwives and the American College of Nurse Midwives, which you can find at these QR codes. And so let's talk about midwifery integration through better legislation and regulation for midwives in California. So remember, midwifery integration equals better birth outcomes and increased access to care. Truly everything that is problematic with midwifery access in California comes down to how we've been regulated and legislated. So both the social and cultural acceptance of midwifery by consumers and physicians and other professionals is impacted by this. Payment and reimbursement equity, meaning sustainability of practice, is impacted by this. Institutional equity, or how we're viewed by the dominant model of care, the hospital model of care, is affected by this. Adequate and sustainable workforce, of course, is as well, and safety and quality of care. These are also the major pillars that need to be worked on in California still. So I'm going to give some examples here. First, regulation and legislation reflecting ICM standards. So one example is that the Medical Board of California, as was said previously, regulates licensed midwives. The solution is to transfer regulatory oversight for licensed midwives to an independent licensed midwife majority midwifery board with the authority to develop an evidence-based practice guideline that meets the needs of midwives and especially the safety of midwife clients. So this means greater safety for the public. This means greater chance of midwives being able to practice to the top of their education and training as suggested by ICM, which means increased access for consumers. What about payment and reimbursement equity? So here's an example. Current reimbursement schemes in California do not pay for the intensity of midwifery care, meaning the comprehensive care coordination, the one-on-one support, the always being on call, the ongoing risk assessment, social support connections, prenatal education, nutritional support. These are all the things community midwives do, by the way. Social support connections, one-on-one support during labor and newborn care. So of course, a solution may be looking into regulations and legislation that support alternative payment models for payers that reward the midwifery model of care, specifically as it pertains to Medi-Cal managed care plans who tend to pay the lowest to midwives. How can we incentivize that they actually pay for the value of the care that midwives give? Here's another example. Home birth is not covered by many commercial payers. Why not? Probably because of all the stuff I said previously and having old data out there that still is part of the cultural consciousness. This reduces access to maternity care during a maternity crisis. So a solution may be to mandate that all commercial payers cover the costs of home birth. Other states have done this. Here is what it looks like on the Aetna website. They say Aetna considers planned deliveries at home and associated services not medically appropriate. However, coverage of home births will be considered when mandated by law. So maybe there's an opportunity there for California. In terms of, I'm just going to check the time real fast. In terms of workforce, California only has one master's level CNM program and one currently paused doctoral program and no licensed midwife training programs. So there's lots of solutions here for the workforce. For example, directed funding for startup of CNM and LM training programs. We could also expand the ability for certified midwives to be licensed and have the legal authority to practice in California. That's the only licensure type that can't practice in California just yet. We could provide rules and incentives that enhance the number of midwifery clinical sites, because clinical sites really make a difference in terms of how many students can be accepted every year. We can create innovations in scholarships and loan repayments so that students will enter the midwife workforce to fill the access gap in high need areas. And we can think about innovations for building up a diverse workforce, like if we directed funding to to a startup of nurse midwifery and licensed midwifery education programs, let's consider what not to do so that we can attract midwives from their communities who are more diverse. And then in terms of safety and quality of care, here's an example in California. We don't have easy or usable access to midwifery outcomes data. Data on licensed midwives is collected, but not really in a usable way, and data on nurse midwives is not collected, at least in the community setting. So there's a strategy here. A solution would be to change the licensed midwifery statute that requires them to submit their data to the Medical Board of California. This is data that's never seen or used, and revamp and fund a program that includes nurse midwives, because data can be used for research and quality improvement, and it's the one thing that creates increased partnership and trust across professions. Additionally, in California, the cost of malpractice insurance is out of reach for most midwives. So one thing that could be that other states have done are state-mandated joint underwriting association for affordable malpractice rates for midwives. And here is an example of this joint underwriting agreement in Washington state. The difference in California between $70,000 to $80,000 per year, which is unsustainable in terms of midwifery reimbursement, compared to about $12,000 a year in Washington state because of this legislation. So here's the final thing. One simple rule. When you are considering maternity care or reproductive health care in regulatory or legislative capacity, ask yourself, how does this affect midwifery care and access to midwifery care in California? Anytime something in reproductive health care comes up. And if you don't know, just reach out to us. Here's an example. In 2024, AB 2129 was a great bill. It mandated that insurers allow providers to bill for a birth and for immediate postpartum contraception, like an IUD, on the same day. This kind of same-day service was previously not reimbursed under most insurance rules. So how does this affect midwifery care? Well, per the writing in the statute, that this only applies for when a birth occurs at a licensed facility. Oops, I'm seeing that sorry, there's something weird on my slide here, but that's okay. So how does this affect midwifery care and access to midwifery care? Well, midwives who provide care in the community setting will not have parity with their institutional counterparts. They will either not be able to offer immediate postpartum contraception, such as an IUD to patients, which is bad for access and outcomes because they can't bill for it, or they'll have to eat the cost of that device, which is not sustainable, or the patient will be left with the bill. So a solution is, don't make the place of care the determining factor in what can be billed if it's within the practitioner's scope. So these are the simple questions that should and can be asked whenever maternity care is legislated. What happens with midwifery access and midwifery care? So with that, thank you for coming to today's presentation. This will be available to you online, a recorded version, as well as, I said, some extra materials to guide your work. Please reach out to us at the Association of Licensed Midwives and the California Association of Nurse Midwives and Midwifery Access California. We're here to help. I know you all probably have to sign off, but we are going to stick around in case there are some questions. One person says, can you speak to if they're, oh, nope, went away. Let's see.
Yeah, there was a question about the community college licensed midwife program. That is all of the information that I can reveal at this time, that there is a community college licensed midwife program in the works that is being diligently worked upon for a very long time. So CALM members will get an update that will be reshared by Maka, undoubtedly.
Great. I'll see if anything comes up into the chat. right, folks. Thank you for joining us today. And oh, we have one. We have one popping in here. Are you all aware of the HCI funding for licensed midwives? Yes, we are. Thank you so much for that, Christina. You're right. That is part of the newer changes that HCI is doing administratively as well after the Midwifery Workforce Training Act. So really great that they are partnering with us on making education more tangible. So I'm a bit confused about the different types of midwives and thinking about regulations. Should all of them be treated equally? So licensed midwives and nurse midwives do have a little bit different scope of practice. As Madeline described, nurse midwives are trained for a hospital setting. Licensed midwives and CPMs are trained for a community setting. Because of that, certain parts about their scope of practice are going to be slightly different. But in terms of what's the same about them is that midwives should be regulating and deciding what that scope of practice is and deciding which cases should be reviewed, how discipline happens, etc. So they are slightly different, but the rules in terms of how to look at the regulatory and licensure process are the same. Hopefully that makes sense to folks. And Elizabeth, yes, of course you can. In a perfect world, if we did not have this mishmash of licensure types that, as I said, was born out of how this country developed its midwifery workforce, we probably would have a consistent one licensure type with different specialties. And then regulations would be able to kind of parse out what occurred in those different sites of care. But truly, we're a little bit far off from that. But we're hopeful that one day there will be a day where these professions have merged, where we've have a board that regulates all midwives, or hopefully a combined group of midwives. That's the goal. That's the dream. Anything else? So are there proposed legislation on the insurance front or other regulation issues, insurance for birth centers? As it is right now, I don't know of any that are actively looking to pursue something around insurance. I mean, there is talk out there a little bit because I think folks are catching on that reimbursement is key, that this is, we can't do this work if you can't get paid or get paid unfair amounts. But reimbursement and payment reform is absolutely the key to sustainability. Yeah.
I will also say that federal law provides that if an insurance policy covered under the ACA offers maternity care, it must offer that care by any provider licensed to provide that care. So there is a federal law that says that. California's implementation of that has been overall quite poor in regard to midwifery care, because California does not have active regulations that clarify midwifery care as being licensed maternity care in regard to the payer relationship. So I'm always available through CALM to have conversations about securing third-party reimbursement for midwifery care, but There's no active legislation in regard to that.
Yeah, and I'm wondering also if this person means malpractice insurance, liability insurance, as we discussed in one of the slides. And to that uh, answer, no. There, in fact, that's been kind of a tiny part of discussions in the past few years, so it's kind of not on the radar as we believe it should be. Yeah. Right. I'll wait and see if anybody else pops into the chat. Oh, what are the first steps for improving legislation that you would like to see? I, is this Holly personally or midwives as a whole?
Holly, personally, say it.
I think there's three big things actually. Regulatory, as I said, being able to have a midwifery board because that is crucial to patient safety. Boards are there for, to provide safety for the public. As it stands right now, if licensed midwives don't have regulations, that's not a normal way to practice, right? Secondly, if they are part of the Medical Board of California, they aren't privy because they're not on the board to things like disciplinary actions or what has occurred in certain cases that require disciplinary action. And that is incredibly important because that informs quality improvement and what needs to be done on the professional level to ensure safety. So and that's just a couple of examples, but that is top of mind. And from that trickles down other things like scope of practice, and from there trickles down access, and from there trickles down payment reform and so forth. So regulation is a regulatory board for midwives is a big one. Second thing that comes to mind is workforce is a problem. Given that maternity wards are closing, we only have a couple of programs in the state. So there have to be multiple levers that are pulled to ramp up workforce. So that could be many. There's not one bill that can do this, but here's an example. After World War II, the reason that residency programs existed and kind of proliferated quickly was that the United States decided to put significant energy into that and funding and connected it to Medicare. And in that way, it ensured that physician training programs existed and expanded. If midwifery programs and clinical sites for midwifery programs, if there isn't some big push from the state or federally, we're just going to be like clawing along here for years to come. So there needs to be a big push towards directed funding for midwifery education programs and the clinical part of that. There's other ways that workforce can be enhanced as well, as I said on that slide, but at this point, we need the space to be able to train midwives. And then finally, of course, I'm forgetting my train of thought. I said three things, but workforce and regulatory would be a really good place to start. Oh, payment reform. Sorry, that's it. Midwives are not reimbursed what they should be. Here's an example. Medi-Cal for a global fee for a provider the provider fee, and Madeline can correct me, is somewhat a little bit over $500. That's it. You can recoup a facility fee if you have a licensed birth center, which is somewhere in the $1,200 range. But as I said in a previous slide, only 4 birth centers in California are licensed because it's incredibly difficult to become licensed. So luckily, that's a bill that is has been introduced. So if we don't think of ways that we can have Medi-Cal increase its rates for midwifery care, knowing that it results in better outcomes and overall lower costs to the state and to the health plan itself, that's a big deal. And at Midwifery Access California, we have put a lot of time and effort into designing a maternity payment model. That's an alternative payment model that addresses specifically what midwives need in order to keep their centers and their business growing and keep the lights on. You can find that on our Midwifery Access California website. So yeah, payment, workforce training programs, and regulation.